February is Heart Month, and Cleveland Clinic looked specifically at some of the overlooked factors that can cause a negative impact on your heart. Joining us now to talk a little bit more about this is Dr. Ashish Saraju with the Cleveland Clinic. Thanks so much for being here with us, Doctor.
Thank you for having me, and good morning.
So let's talk a little bit more about this survey, about this study that Cleveland Clinic did at these unrecognized heart health risks. What did the survey uncover?
Yeah, so when we asked Americans about these uncovered heart health risks, we found that a significant number were unaware of things like lack of sleep, tobacco use, alcohol use, diabetes during pregnancy, and high blood pressure during pregnancy as risk factors for heart disease. So that's an opportunity to educate. We also found that 3 out of 5 Americans were not taking their heart medications as prescribed or skipping doses, which is another opportunity for us to educate.
We tell healthcare providers when it comes to, just maybe driving these points home with their patients. Like you mentioned, that survey found only about 40% of Americans recognize the dangers of some of the things you mentioned, like drinking and tobacco use, along with sleep deprivation.
That's right, yeah, and so it's incumbent on us as healthcare providers to drive this home, especially in the context of, some mixed messaging around, for example, alcohol use and its association with heart health. So it's incumbent on us to drive home the point that alcohol use is a spectrum. There's no magical number of drinks above which it's unhealthy, below which it's healthy. It's really a spectrum, and really any amount can increase blood pressure, it can increase cholesterol levels, and it can contribute to heart health. So opportunities to educate all around.
I wanted to talk to you about what you mentioned about skipping your heart medication. What are some of the consequences of that?
Yeah, that's such an important point, because in some cases, for example, if you have heart disease, skipping medications like your statin medications has been associated with an increased risk of death or mortality. If someone got a recent stent in their heart, skipping the prescribed medications can be very, very dangerous, can lead to a recurrence of heart attack early after the stent procedure. So the consequences can be pretty dire. And so it's very important to talk to your doctor if you're skipping medications or if you're finding that you're missing doses of medications, to come up with a strategy where you want to minimize that as much as possible.
Dr. Saraju, what about when it comes to heart health screenings? What should people be looking out for? What should they be talking to their doctor about?
Yeah, and it's an important question there. And, the first thing is to establish a strong relationship with a primary care doctor, get your annual physicals, get your routine blood tests. This may include blood glucose, this may include cholesterol levels, checking your blood pressure, talking about your lifestyle habits, and discussing your family history. So really getting that comprehensive picture is a good first step. And in some cases, there are genetic markers, like a particle called lipoprotein A. That may be worth checking if you have a strong family history of heart disease, especially. That can then help inform strategies to reduce heart disease over the course of your lifetime.
Dr. Saraju with Cleveland Clinic, thank you so much for your time this morning. If you would like more information, you can head to our website right now, WPBF.com, or download our free WPBF 25 News app.